Nancy. I'll be your student nurse for today. Let me just wash my hands. Can I have you verify your full name and date of birth, please?
Yeah, Zachary Mason, February 6, 1999.
Okay, perfect. And that's what I see here on your wristband. All right, so today I'm going to be doing a head-to-toe assessment. Let me provide some privacy for us. That is exactly what it is. It's just a head-to-toe assessment. I'm going to need to be touching you a few times and listening to you with my stethoscope. Is that all right with you?
Yeah, that's fine.
Okay, perfect. So first we're going to start with some personal questions. So if you feel uncomfortable at any time, please let me know.
Okay.
Have you noticed any changes to your mood recently?
No.
Okay. And do you experience any depression or anxiety?
No.
Okay. And have you ever had any suicidal ideations?
No.
Okay, perfect. And do you feel safe at home?
Yes.
Okay. All right. And I noticed that he is well dressed and well groomed, and I don't notice any tubes, lines, or drains that could be a safety hazard for the rest of the assessment. All right, so we'll start with neurological. Can you tell me why you're here for today?
Annual checkup.
Okay. Can you tell me where you're at?
The hospital.
Okay. And can you tell me what time of day it is?
It is, wait, what time?
Or what day it is.
November 18th, 2022.
Okay, perfect. So a patient is alert and oriented ×4. All right, so I'll just have you grab my fingers. We'll assess strength. Strength is equal and strong bilaterally. I'll have you push up towards the sky and then back down. Okay, and then I'll have you push up towards the sky with your legs and then back towards you. All right, so those feel nice and strong and equal bilaterally as well. All right, and do you experience any issues with sleeping?
No.
Okay, and do you experience any headaches, dizziness, or anything like that?
No.
All right, okay. Next we'll be assessing your head. I'm just going to be feeling for, and let me know if you have any tenderness.
Okay.
All right, so hair is appropriate and well done. Do you feel any tenderness at all?
No.
Okay. Have you noticed any lesions or anything like that?
No.
Okay. So I'm just going to be taking a look at your ears. Right. Have you noticed any recent hearing changes?
No.
Okay. And do you have any tenderness when I feel?
No.
Okay. And let me know if you can hear this.
Yes.
How about on this side?
Yes.
And then both?
Yes.
Okay. And then I'm just going to look at your eyes. I'm just going to shine this light in there. You can just look right past me. I'm just going to be looking at your pupils. All right. And then if you just want to keep your eye on the pen. Perfect. So pupils are equal, round, and reactive to light, and accommodating. So I notice that there's no discharge. Eyes look fine. And do you notice any recent vision changes?
No.
Okay. And do you see the eye doctor regularly?
Yes.
Okay. I'll have you look up. I'm just going to take a look into your nose. All right. Septum is midline. Mucous membranes are pink and moist. No excessive debris or any blockages. So I'm going to be looking at your mouth, if you wouldn't mind smiling. Dentition looks fine. And then I'm just going to take a look inside, so I'll have you say ah. All right, tongue is midline. I noticed you still have your tonsils, is that right?
Yep.
Okay. And no redness or anything like that. Gums are pink and moist. Do you see the dentist regularly?
Yes.
Okay, perfect. And do you have any issues with your dentition?
No.
Okay. So I'm just going to be feeling your neck. Do you have any tenderness with your lymph nodes?
No.
All right. And I don't notice any swelling or anything. So I'm just going to be feeling your trachea. Looks like trachea is midline. Perfect. Okay. So we'll move on to respiratory. Do you experience any shortness of breath at all?
No.
Okay. So I'm just going to be assessing to see if he has any using any accessory muscles to breathe, as having any shortness of breath. I'm going to be looking at his APT, so that it will be 2 to 1, so that looks appropriate. And I'm going to be assessing his skin for any lumps, masses, or skin changes that could affect his breathing as well. Right, so I'm just going to take my stethoscope and listen under your shirt to get the best sound in a few places. So if you could just take a deep breath in and exhale every now and then, I should be able to get a good listen.
Okay.
Right, same thing on the back. Alright, so no adventitious lung sounds auscultated there, so that looks good. Do you have any other questions about your respiratory system?
No.
Okay, we'll move on to cardiac. Do you experience any chest pain at all?
No.
Okay. Alright, for this one I will be listening to a couple different valves of your heart. So I will start with the aortic, pulmonic, tricuspid, and mitral. All right, so I'm going to be listening to your apical pulse for about 60 seconds and make sure there's no irregular heartbeat, extra beats, palpitations, or murmurs. All right. So it's been 60 seconds and I got 72 beats per minute. I heard S1 and S2, the lub-dub, and it all sounded normal to me. And 72 is within normal range, so that looks good. All right, and then so I'm just gonna take a feel for your radial pulse, just right here. Feels equal and strong bilaterally. Your skin is warm, and then I'm gonna look at your cap refill, less than 2, which is normal. And then I'm just gonna be feeling your pedal pulse. Perfect, those are equal and strong bilaterally. And then cap refill is also 2+. And then I don't notice any excessive swelling or edema, no pitting or anything like that. Do you notice any fluid retention at all?
No.
Okay. Perfect. And then we will move on to the next section. So for this next part, I'll have you lay down. Have you noticed any changes to your appetite or anything like that?
No.
Okay. And when was your last bowel movement?
Today, earlier.
Okay. And how would you describe it?
Solid.
Okay, sounds good. And do you experience any nausea, vomiting, or diarrhea?
No.
Okay. And have you noticed any abdominal changes at all?
No.
Okay. And then for urinary or genital, do you experience any pain, odor, discharge, or anything like that?
No.
Okay, perfect. All right, so I'm just going to be listening to the 4 quadrants. Okay, valve sounds auscultated in all 4 quadrants. And then I'm just going to palpate and let me know if you feel any tenderness at all.
Okay.
So just going to feel. All right, do you feel any tenderness?
No.
Okay, perfect. All right, so you can have a seat back up. Here's your chair back. I'm going to have you stay standing we're just going to assess your musculoskeletal now. So we're going to assess some strength. So if you could push towards me, and then how about back towards you? All right. And then I'll have you, we'll just do 1 foot at a time. If you could push towards the sky, and then back down like a gas pedal. Okay, and then the other foot. And then back towards you. Okay, so those are equal and strong bilaterally. We're just going to test some range of motion, so if you can just mirror me, we'll do some swings with your wrists. And then how about your shoulders? Do you notice any stiffness or soreness there?
No.
Okay, and then same thing with your feet. Other foot. And how about with your lower extremities? All right, range of motion looks good there. I'll have you take a walk that way and then just come straight back. All right, gait looks steady and even. Do you have any issues walking at all?
No.
Okay, perfect. All right, and then I'll have you turn around. And then if you wouldn't mind touching your toes, I'm just gonna look at your spine. I'm just gonna feel for any curvature. It looks like your spine is straight and midline. All right, perfect. You can have a seat again. All right, so next I'll be assessing your skin. So I have your hand. Skin is warm, dry, and pink. And then I'm just gonna feel for your turgor. All right, so you look bounce back normal. Do you experience any dry skin, irritation, or rashes at all?
No.
Okay, and do you notice any moles or lesions or wounds that you're concerned about?
No.
Okay, so I would just kind of assess his skin and make sure I don't notice anything out of the ordinary there. And looks like it's fine. All right. I think that concludes our head-to-toe assessment. I will let the doctor know that you're all ready for him. And do you have any other questions?
No.
All right. Assess the room for safety. And here is your call light.